I was a PA and then went back to med school and often met with shock or why did I go back? And I think, in terms of advice to give those who are trying to decide between either PA school or med school, I would look at the roles specifically as a PA or a physician. It helps if you have an idea of what field of medicine you want to go into. So if you are like me and want to do neonatology, I would kind of reach a peak as a PA in neonatology in terms of just kind of like career growth trajectory. I'll always be working under a physician who will get the ultimate final say in patient care. But if I was in primary care as a PA, I would have a lot more autonomy. So I would have my own patient panel, see my own patients, follow up on their lab work, come up with treatment plans, and then if I had questions, I could always find one of the physicians to kind of run through the patient list with. If you are the kind of person that needs to know nitty gritty details to understand the bigger picture, then I would say med school is probably more up your alley. PA school is definitely intense. It's a hard 2-year graduate program, but there are in-depth pieces at times that can be missing from your education. And that's simply just because there's not enough time to cover it all in PA school because you have 1 year of didactics and 1 year of rotations. People are afraid of med school because of the time commitment. So the 4 years of med school with a residency and possibly a fellowship. And I agree that is a long time. So it definitely has to be something that you are willing to commit to. I still had a family. I have 3 kids all throughout my training. I was a pediatric resident, which I would say is a little more family friendly than some of the other like surgical specialties. But that being said, I don't want that to be a huge barrier. You can figure out ways to work around it, and hopefully in another 5-10 years we'll see some improvement in terms of being family friendly towards residents. But I think if you're an undergrad trying to decide between the two, talking to as many doctors as you can, talking to as many PAs as you can, really just ask them like what would they change about their job, or what would they change about their career, or what do they wish was different, things like that. I know when I was trying to decide between the two, I'd meet doctors that said that they should have just done PA school, and then I met PAs that were like, oh, I should have just done med school. So it's definitely not an easy decision. I'm always happy to answer any questions, so just let me know if you have any.